Happy St. Patrick's Day. This is Dr. Michelle Weaver, and I'm your local county health officer for Bradley County. And today, this video I wanted to put out about quarantine. And there's a lot of questions about quarantine and what that means, and I discussed this yesterday, but there's been a lot of concern since then. Currently, we've had some new updates today. We do not have any new confirmed positives as of today in the state of Arkansas. We did have 22 cases as of yesterday and 22 today, and we've had a significant number of new negative cases. Although this is wonderful that we've had a good number of negative cases, it is still possible that the coronavirus is in the community. We have had little community spread in the state of Arkansas overall due to good public health support and people following recommendations. Unfortunately, there are some rumors, things being told to me. I cannot personally state that this is occurring, that there are people who have been directed to quarantine that are leaving their homes. And these people are going shopping and not following advice. And this is my response to this activity. And if you're one of these people who are quarantined and you left your home, it is possible that maybe you don't understand quarantine, maybe you don't understand what you're supposed to be doing, and I'd like to go over that in detail with you. All of this information is available through the Arkansas Department of Health. You can find information about quarantine online. So first of all, people who are quarantined are people who are exposed to COVID-19 and not necessarily are sick. People who are quarantined are not isolated, they're quarantined. So that means that you may get sick, you may not get sick, and many of these people are being tested. Some have not been tested, but they've been given advice about quarantine. So who needs to be quarantined? Anyone that's been exposed to a known COVID-19 case, or if you've traveled to an endemic area. What do I do to properly self-quarantine? Separation. If you're potentially infected, please separate yourself from your partner, anyone else that lives in your home, your children. The CDC actually recommends that you separate yourself from your pets. COVID-19 is a zoonotic infection. Stay home, and that's what you should do. You should stay home. The only time you should leave is when you need to go see your doctor or go to the emergency department. No trips to your office, no trips to school, no shopping. If you're shopping, please don't stop and talk to someone. If you are supposed to stay in one room in your home, pick a room, that's your room, and the rest of your household will stay in other parts of the room. So you have your own room and you have your own dedicated bathroom and sink for you. You should not have visitors. If for some reason you're around other people in your home, even your loved ones, you should stay 3 to 6 feet away from others, and don't take any type of public transportation. We don't have that here in our county, but in case for some reason you do decide to go shopping against advice, please don't take any public transportation and expose other people. You should wear a mask when you're around other people. You should practice good hygiene. If you're on quarantine, please, we all should be practicing good hygiene. That is a recommendation for everyone. But if you are quarantined, if you cough, sneeze, cover your mouth with a tissue, your elbow. Use a tissue when you're at home. Throw that tissue away into a lined trash can. Wash your hands immediately with soap and water for 20 seconds. Use a hand sanitizer if you don't have soap and water with the 60% alcohol content we spoke about previously or higher. Use that. Even if you haven't, these are all rules for quarantine patients. If you haven't coughed or sneezed, you still need to wash your hands frequently and avoid touching your eyes, nose, mouth. Even if you just washed them. For other quarantine information, disinfect often. Don't share your dishes, your glasses, your cups, eating utensils, etc. Your towels, your bedding. It shouldn't be shared with anyone. That should only be yours. That includes your pets, your bedding, your towels, your glasses, your cups, what you eat out of. Don't share with your pets. And then wash these items after you use them. Countertops, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, bedside tables are all high-touch surfaces. Wipe them down with household cleaner regularly. And also frequently wipe down any surfaces that might be contaminated with any bodily fluids, such as like in your restroom. And another question is, what about family members that live with the quarantined? So, you know, if dad comes into contact with a positive patient, mom and kids have not come into contact, what do you do? Household members can all still live in the same home, but it's going to be their job, the ones who are not quarantined, to stock up on groceries and prescriptions, take care of the quarantine, to keep the area clean. This does not mean to go and stockpile food, but to provide food and help take care of the quarantined patient. If you're elderly or need assistance in your quarantine, please inbox us here, and I can get you in contact with people that can help you. I know our city and other local outreaches are in the works to help people that are quarantined. When you're around that symptomatic patient in your house, so you're the family member and your family member's quarantined, you're just the family. When you're around them, you need to wear a face mask and gloves, especially if you have to contact any bodily fluids, and make sure you throw them away and don't reuse anything that has any bodily fluids or the droplets on it from a cough. Other important things about being quarantined. If you're quarantined for a reason. You've been exposed to a virus that can make you pretty sick. And at the time you're quarantined, you likely feel fine. So during this time, it's a good idea to monitor your temperature. You could keep a log of your temperature, monitor your symptoms of cough, shortness of breath. And then if these problems begin to occur or get worse, you can contact your physician and they can address that from there. But also take care of yourself medically if you're quarantined. You're taking care of yourself and you're taking care of others. And I'd just like to reiterate that I cannot verify that quarantine people have been out in the community. There definitely are rumors that this is happening. If this is you, please stop doing this. If you're quarantined, stay home, follow the guidelines, care about your neighbor, and take care of yourself, and let's all take care of each other. If there's any questions about this, let me know. Remember, quarantine does not mean positive. The majority of the people that are being tested are negative, like I said at the beginning. So this discussion about quarantine should not cause panic. I want people that may possibly be quarantined to take it seriously, follow the instructions, and if you aren't sure about what you're supposed to do with quarantine, I would be very happy to go over this with you again. You can watch this video again and go through the recommendations. We're going to put out some of these recommendations for people to read, and about cleaning their home, what to do while they're in their home while they're quarantined. And hopefully this can decrease the spread of the virus in our community and others. Have a great day. God bless you.